Go.
Check the chart. Knock on the door. Come in. Wash my hands. All right. Hey, Joe. I'm Bryce with your man nursing program.
Nice to
How are
meet you.
doing today?
I'm well. How are you?
Can I check your wristband? And can you tell me your full name and date of birth?
Joseph Dietz, 3775.
All right, good. Should grab some privacy. All right. Can you tell me what today's date is?
December 2nd.
All right. Do you know what season it is?
My favorite, fall.
All right. And do you know where you're at right now?
I'm at Germana Community Wellness Clinic. Yeah, that's where I'm at.
All right. Well, I know he's alert and oriented. Maybe his speech isn't all up to date, but he can still communicate effectively. All right. What I'm gonna do before I take your weights, can I get you to squeeze my fingers? All right, good. Now, can you push against my hands? All right. Can you pull against my hands? All right. Can I get you to push your foot down? Up. I'm doing it at the same time. All right. Can I get you to pull your foot up? All right. Good. So he has strength, equal bilateral strength in upper and lower extremities. All right. Now, can I take you over to the scale here?
Put on grip for safety.
Yeah. You should have had shoes on. Alright, so you're at about 74 pounds. I'm gonna check these out.
This one's not balanced very well. Not all the way up. You can't reach it.
Alright, he's about 6 foot. What's up? Should make that difficult to reach. Alright, so I have that. Now we're gonna take the vital signs. If you can sit over to this side a little bit.
Yep, kicking my shoes all the way for safety. That would be funny.
Alright, can you put this under your tongue? Alright, temperature is 98.1. That's good. You know you don't have a fever, I don't have to kick you out of class. Alright, where's the blood pressure? I'm gonna check your blood pressure. Go ahead and hold your arm up. Alright, 132 over 88. For you, that's a good one. Since your last visit here. Alright, now I'm going to check your pulse. 100.
What?
Your respiration to 16. I'm gonna check your O2 set. This one. Go ahead. O2 set is 97. Oh, so your pulse a little high. Are you nervous? You getting white coat syndrome?
I'm on film.
All right. So now I'm going to start on the heat exam. First, I'm gonna inspect. His head is midline with his body.
It's always been the same symmetry.
You're right. All right, now I'm gonna check for lumps, bumps, bruises, infestations, or lesions. I see you have a scar here. I'll ask about his history. She'll tell me later to save time here. All right, and now what I'm gonna do is I'm gonna go on to his eyes. About the pen. All right, can I get you to stare directly at the light? All right, checking convergence stare. Now, can I get you to follow the pen with just your eyes? All right, check this cardinal fields of view. Now I'm going to, can you actually look all the way left? All right, now all the way right. All right, good. I'm gonna pull down this eyelid. Can you look up? All right, conjunctiva pink, sclera clear. This side too with a different hand. All right, conjunctiva pink, sclera clear. Now can you stare straight at me? All right, I was checking for perla. Pupils equal. Oh my gosh. Pupils equal, round, and reactive to light and accommodation. Now I'm going to use the ophthalmoscope and look at ocular fundus. All right, it's a good orange, reddish color in there. All right, same on this side. So with doing those eye checks, I checked the cranial nerve 2, 3, 4, and 6. And the size of his pupils were about 3. When's the last time you been to the eye doctor?
Just earlier this month.
Earlier this month?
Yeah.
All right.
I just got these glasses yesterday, actually.
Okay, cool. So do you wear any contacts or just glasses?
Just glasses.
Just glasses? All right, good. Now I'm going to move on to his ears. I'm going to check for pain. Tell me if you feel any pain in here.
No.
Nope, none. All right, I see the ears are symmetric. I'm checking midline the eyes. Now I'm going to use the otoscope to check the inside of your ear. I'm going to pull up and back. All right. I see the cone of light. Membrane's intact. Not much wax, so the ear's clean. Go to the side. All right, see the cone of light, not much wax. Temporal membrane intact. All right. Now what I'm gonna do is the whisper test. So can I get you to plug one of your ears?
Basketball.
All right.
Football.
All right. Good. So you passed that. All right. Now I'm going to move on to the nose. All right. So first, can I get you to close your eyes? All right. So tell me what you smell there.
Peppermint.
All right. Correct. Holiday season. All right. Now I'm going to inspect. I see his nose is in between his eyes, in the center of his head. All right. Do you have any trouble with breathing?
I'm a little congested.
A little congested? Can I get you to plug one nose and take the deep breath in? Alright. Can you do it with the other nose? Alright, good. Now can I get you to lift your head upwards? Then we're looking. Each nair is pink and moist. No deviated septum. I'm also going to palpate his sinuses. Start with the frontal. Tell me if you feel any pain.
No.
The ethmoid and the maxillary. Any
Nope.
pain there? Nope. All right, good. Now I'm going to move on to the mouth. I'm going to inspect around the mouth for ulcers or cracks and moisture. All right, so his lips look in good condition. Can I get you to open your mouth? All right, good. I'm going to look around for anything else. Can you stick your tongue out? All right. Is uvula is midline? Can you move your tongue left and right? Lift it up. All right. Teeth and everything look intact and are clean. Now, when's the last time you been to the dentist?
Just the other day.
Just the other day? All right. Good. And actually, I'm going to stick this tongue depressor in his mouth to check for his gag reflexes, which still actually currently works. Now, can I get you to swallow for me? All right. I said he can swallow, so I was checking cranial nerves 9 and 10. That. Now I'm going to move on to the neck area. What I'm going to do is I'm going to feel for his thyroid, to feel for an enlarged thyroid, which I do not feel. Do you have any pain around there, sir?
No.
Nope. All right. Now I'm going to check his lymph nodes. I got the preauricular, the postauricular, the tonsillar, the submandibular, the submental, the anterior cervical, the posterior cervical, the supraclavicular, the infraclavicular, and the occipital. All right, and now I'm done with that. And I'm gonna just look around his skin for any lesions. Have you had any new lesions or any cuts that you haven't noticed? All right, skin looks intact. I'm checking the turgor. All right, turgor is good. Yep, so turgor is good on that. Perfusion is good. No known edema. Can I get you to put your fingers like this with your nails? All right, so no clubbing of his nails. And the hygiene looks good. All right. Or I should say smells good. Cut, right? All right, now I'm going to move on to the respiratory part. Take these gloves off.
So I can put my glasses back on?
Yes, sir, you can. And I'm going to start off from the front, auscultating. Checking the bronchial, 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 bronchial. See if we should have some. Bronchofascicular, bronchofascicular, vesicular, and vesicular. All right, no adventitious sounds heard in front. Once again, bronchial, 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 bronchiovesicular, bronchiovesicular, vesicular, and vesicular. All right, so I heard no adventitious breath sounds in the front or back. Now I'm going to do a diaphragm excursion. Can I get you? Well, my hands were cold. I forgot to warn the patient of the cold hands. Right.
They were warmer with your gloves on, dude. Put those gloves back. All right, go ahead.
Always warn your patients. All right. So can I get you to take a deep breath? All right, good diaphragm excursion, about 5 mm. All right, and now I'm gonna check for tactile fremitus. Can I get you to say 99? Or fremitus?
99.
All right.
99. 99.
All right.
99. 99. 99.
Always warn your patients of cold hands. Now let me ask, do you have any history of smoking?
Yeah, I used to smoke when I was a teenager. It was the 80s, man. Don't judge me.
Okay. Do you have any cough? Any sputum?
No, not really.
No? Alright, and I saw that his breathing was fine. He wasn't short of breath at the time. Do you ever experience any shortness of breath? No? Alright. Now I'm going to percuss these areas. And they're all resonant sounds. How about look on film?
Missed that one. Sorry.
All right. So all resonant sounds with the lungs. All right. Now I'm going to move on to the cardiac. I'm going to first start with the aortic, which is the second intercostal rib on the right sternal border. Okay. Now the pulmonic, the second intercostal rib on the left sternal border. Then Erb's point, which is third intercostal rib, left sternal border. Then the tricuspid, which is fourth intercostal rib, left sternal border. And then the mitral, which is fifth intercostal rib, left midclavicular line. I heard S1 and S2 sounds were audible, no extra murmurs. That sounds, no abnormal sounds. I'm going to listen to his carotid artery for any bruits. Nope. So no, now I'm going to check his pulses. I'm going to start with the temporal pulses. Alright. I'm going to check his carotids. One at a time. Alright. Now I'm going to check his brachial pulses. Alright. Now I'm going to check his radial pulses. Alright. Now his ulnar pulses. And things just slide this way.
So since we don't have to check.
I'm going to check his femoral pulses. Or popliteal, and the femoral I would check it there. And I'm going to check his tibialis posterior pulses. Alright, and now I'm going to check his dorsalis pedis pulses. Alright, they're all 2+. Alright, and I saw no edema in the legs. And I'm going to check for cat refill in his hands. Alright, and it was less than 3 seconds. So, now I'm going to go on to the gastrointestinal. I'm not going to get you to lay that out. I'm inspected. I see he just has a tattoo. Are you having any pain?
No.
Here?
No.
Alright. Any problems chewing, swallowing?
No.
Any indigestion?
I'm on, I have GERD.
You have GERD? Okay. Do you take medicines for that?
Yes, I gotta be.
Alright. Now I'm going to first auscultate the right lower quadrant. Listening for 5 to 20 sounds. Alright, the right upper quadrant. The left upper quadrant. And then the left lower quadrant. Alright, so those bowel sounds were active. 5 to 20 sounds within a minute. If there are any problems, I would listen for 5 minutes. Now I'm going to lightly palpate it with my hopefully warm hands. So tell me if you feel any pain. Obviously my hands are still cold with the tensing. So we're gonna hope my hands warm up. Alright, any pain there?
No.
All right. And now I'm going to do a percuss. All right. And sounds were tympanic. Now I'm going to do his musculoskeletal history. Have you had any history of falls?
No.
No history of falls. And I saw earlier that his posture was upright. His swing was appropriate, and that his gait was steady. Now I'm going to have you do some range of motions. Can you sit up real quick? All right. Now, can I get you to shrug your shoulders, which checks for the 11th cranial nerve? Can I get you to, yeah, wow, he must know what's going on. Can I get you to touch your left ear to your left shoulder? Same with your right side. Can I get you to look left, look right? Can I get you to raise your chin to the sky and put your chin to your chest? When your head is straight, can you do that? All right, good. Can I get you to raise your arms? All right, can I get you to raise them above your shoulders? All right, bring them back down. Can I get you to bring them forward, pull it back? All right, any pain there?
No.
Nope. Can I get you to pronate and supinate your arms? All right, good. Can I get you to squeeze your fingers, open them up, spread your fingers and close them? All right, now can I get you to kick out both of your legs? Your legs. I should add you flex and extend your arms. Now can you flex and extend your legs? All right, pull it in. All right, other leg. Out and pull it in. All right, now can I get you to flex your toes forward, pull them back? All right, can I get you to open your toes and close them? All right, so range of motion is good.
On the table. It's on the table over here.
It is.
It's under
Oh, it's
that.
hidden. Oh, I hit my own piece. All right, now I'm gonna check his reflexes. So I'm gonna start, with my cold hands again. So I'm gonna start with his brachial. All right. Or his biceps. Now I'm gonna do the triceps. All right. Now I'm gonna do the supinator. All right. Now I'm gonna do his patellar. Can you just scoot off just a bit? All right. All right. Now I'm gonna go to this side and do his biceps. I'm gonna do his tricep. Supinator. And I'll also do the patellar. Right, and I'm gonna do his Achilles. Both sides. Alright. So reflex is normal as well. I'm gonna do his sensations test. Alright, so can you close your eyes for me? Alright, so can you tell me how that feels? What type of pain was that?
I wasn't pain.
It wasn't? Alright.
It was like pressure.
Alright, so would you call it dull or,
Yeah, dull.
sharp? Alright, can you tell me how this feels? Did you feel that? It's pretty pointy.
Oh, that's not. I can feel a point now.
Alright, so that's sharp. So I checked his sensations. He felt my cold hands, so he knows the difference between hot and cold. From observing his muscle strength is 4+.
You should make that 10 plus. What?
Yeah. Don't listen to him, guys. I'm the doctor.
Nerds.
We have to cut this out the video. All right. Now, have you ever had any problems urinating?
No.
All right. So when I was palpating earlier, the gastrointestinal, I didn't feel any problems with his bladder as well. All right. Do you do self-examinations of your testes?
Says that it's deferred for students.
Not that part.
Yeah, I
Yeah.
test all the time.
Alrighty.
Aren't you bad and nasty?
Alright. No, just gonna ask a couple questions. Alright. So, based on Erickson's developmental stage.
That's just Holcomb.
I put you into generativity versus stagnation because he's 40 years old and he has children.
I still like to think I'm in identity versus.
Alright, so he may want to be in intimacy versus isolation.
Well, I'm 40, so I can be both.
Yeah, he's right on the borderline, so give or take a few years. Alright, do you have any religion or cultural needs that will affect nursing team?
No,
Nope.
I'm pretty easygoing.
Alright, and what type of education do you have?
Some college, military training, and high school.
Alright, so that's good. So he'll be able to understand the little pamphlets we'll leave with him. Alright, if he's in his hospital bed, I would put the call bell in, lower the bed as much as possible, raise the bed, raise his side rails. Then I would ask him, is there anything else? See, he wants to leave so fast. Is there anything else you would that you need or that concerns you before I go?
No.
Alright, so that's good. So I'd wash my hands and I leave and then I document.
Thank you.